Good evening. This is City News at 6, and we begin with breaking news tonight. A new presumptive case of COVID-19 has been confirmed in BC, and the patient is being treated right here at Vancouver General Hospital. Now, this latest case is a woman in her 80s who recently traveled to India and Hong Kong. She is listed in critical condition at VGH. That brings the total to 13 patients in our province. 4 of those patients have fully recovered, and 3 no longer have symptoms but remain in isolation. There are 34 cases across Canada.
Right now, the investigation is ongoing. We're looking at the time period that she and others were on a tour group in India, and so who else was on that group, what kind of exposures they might have had. Currently, India is not reporting a lot of cases. They're reporting mostly sporadic imported cases, though in the last couple of days there's been a slight increase in that. So that's clearly one thing we're investigating. Some of the other people who were on this tour were friends that are now in other parts of Canada or in Hong Kong.
While Henry notes the risk is changing daily around the world, the risk of the virus spreading in BC remains low. If you've been tested for COVID-19, doctors ask you pay attention to your health and how you're feeling. And you can call 811 anytime to talk to a nurse and get advice about how you're feeling and what to do next. Washington State has reported its 10th death from coronavirus. Many of the deaths have been linked to a nursing home in the community of Kirkland, not far from Seattle. The Department of Health released some updated stats this morning and says there are currently 39 COVID-19 cases reported in Washington State. Here in Vancouver, the 13th confirmed case in BC is here at Vancouver General Hospital. It's a woman in her 80s. She recently traveled to India and Hong Kong. We will continue to bring you any updates, if there are any, throughout City News, and you can always check online at citynews1130.com.